Welcome to another episode of Mera Doctor. We are talking to Dr. Prashanth, an ENT surgeon, and we will be covering snoring as a topic today. Welcome, Dr. Prashanth. Can you tell us more about snoring? I'm sure everybody is aware of it, but medically, what is snoring?
So, snoring medically is called obstructive sleep apnea, or it can also be called a central sleep apnea. So, obstructive sleep apnea occurs when the patient is not able to breathe normally through the nose and ends up breathing through the mouth. Another cause for snoring in obstructive sleep apnea is when the person is overtly obese. Because of obesity, the patient can't breathe normally because of restriction. Secondary to the fat deposition in the abdomen and in the chest area, it causes restriction of the lungs to expand. Secondary to which it causes apnea. Apnea means cessation of breathing.
That loud noise that all of us hear, when certain people snore louder than some others. So does that indicate that it's always a problem? Because I've seen some families, all of them are impacted by it or affected by it. Everybody would be snoring, but I've not seen it usually show up as some symptom. But do you think it's a problem or it's something which is common?
Snoring is pathological.
Okay.
It doesn't mean that whoever snores is okay, it's just deep sleep. Some people snore excessively, that means they are very high risk of developing multiple complications. The complications include diabetes, hypertension, heart disease, lung disease, and secondary to all these things, there will be multitude of other syndromes which can occur. So snoring, especially in obese patients, is very, very bad.
So when you say it causes hypertension, I would have never guessed that it can cause hypertension. I could have still thought maybe heart related issues, probably because of the breathing or lungs related issues. How does it impact into hypertension?
When you are snoring, what happens exactly is your body is not getting sufficient amount of oxygen. So when the body is not getting a sufficient amount of oxygen, it releases stress hormones.
Okay.
So when the stress hormones are released, because of which the blood pressure shoots up.
Okay.
There will be release of corticosteroids, there will be release of adrenaline. All these things impact the blood pressure. That's why people who are snoring usually tend to be on the heavier side. The reason behind that is the corticosteroids which are released will further worsen the fat deposition.
Okay. And I think it's also correlated, right? Because what I've read is that because some people are obese, they tend to snore a lot more because the neck swells up and there is a fat deposition and all that. So what's the truth behind it?
It's very true. So people when they're obese, the pad of fat underneath the tongue becomes thicker, and also around the neck becomes thicker. Secondary to which it causes compression on the trachea, and also because the fat is here, it will cause the tongue to fall back. Secondary to the tongue falling back, it causes more amount of snoring.
You're saying in every case, snoring is something we need to get a look at, and we have to try and see how we can take care of it, right?
Yes.
What are the first steps that we need to look at if we identify that I'm snoring or one of my family members are snoring? How do we go about it? Do we need to do something? Do we need to go to the doctor straight away, or what are some of the things we need?
So the first thing which you need to do is you need to ensure you can calculate your BMI. Anything beyond 35 is causing morbid obesity. They have to first focus on reducing the weight. Once you reduce just 5 to 6 kgs, that has a lot of impact on your snoring. People have just lost 5 kgs and they have completely stopped snoring.
Okay.
So that's the first step which anyone would do. Definitely you have to visit a doctor to assess what are the actual causes for snoring. So from the ENT perspective, there are 3 causes or 3 regions which cause snoring. One is the nasal area, because of the nose, because the patient is not able to breathe exactly through the nose, they develop snoring because of mouth opening. Number 2 is if there's any hypertrophied tonsils in the throat, which again cause cessation of breathing.
Okay.
That also causes
Sorry to cut you off. When you say hypertrophic, what does that mean?
enlarged tonsils.
Okay.
So when the tonsils are enlarged, again it causes difficulty in breathing. Number 3 is if there's any issue in the laryngeal area because of the neck compressing, if there is a short neck, if the fallback of the tongue is excessive, that causes a problem in the voice, in the laryngeal region. So there are 3 regions which we need to assess and then take care of it accordingly.
So when you're talking about the nose itself, many of them, at least what I've read, is about 80% to 90% of the people don't have a straight nose. There is a crooked nose. Most of us have in different proportions of the nasal cavity. So does that also impact that not being straight, or does that mean that 80 to 90% of the people, there is a good chance that they can actually get some of these symptoms?
So definitely, as you told, no one has a perfectly straight septum. People who have very grossly deviated septum have the issue of not breathing through the nose.
Okay.
So mild DNS is not a risk factor. Gross DNS, that is a very big deflection of the septum towards one side, is a cause. And also not just the septum, there will be other issues inside the nose which can cause obstruction. All of them can be a leading or a potential factor for snoring.
Okay, so it's not necessary that the 80% of the people whose nose is not perfectly aligned, all of them will have to suffer with this.
No, not necessary.
Okay.
People who have nose block or nasal obstruction are more prone to developing snoring or obstructive sleep apnea.
So generally, because see, like I said, I've seen a lot of people snore or heard a lot of people snore. So what is the percentage of people that you think are affected by this?
Snoring, there's no rational study which has been done to assess, okay, this amount of people are snoring or snorers. So, but in my clinical practice, I have seen at least some 20% of my whole patient load will be snorers.
You're saying it's always pathological. There is always a cause behind it.
Yes.
We need to identify it early so that
Yes.
we can actually try and fix it
Yes.
early as well. And there are some funny stats when I look at it. When I was just going through some of the risks that can affect snoring, one of the things is being a man itself. So is that really a problem, or is that just because usually there is more instances of people snoring, man snoring than a woman?
Well, men don't care about what they eat most of the time. They are not conscious about their shape. So that leads to more number of men ending up having obesity, secondary to which they snore more.
Okay. So it's not the other way around. It's not just because there's a man, he needs to have that problem.
No.
It's because they're not taking good care of themselves, and that leads to this.
Yes.
And another common thing is that, drinking alcohol or alcohol consumption causes snoring. Is that true or just a myth?
That is true.
Okay.
The reason behind that is when you booze a lot, as the common people say, they will have laxity of the tongue. The tongue tone will be lost. Secondary to which the tongue fallback is more. Second to which they will have snoring.
It's a secondary effect of the alcohol consumption, but can that also cause serious issues? I know that alcohol itself is a different topic. I think we can discuss about it in length, but just talking about the breathing itself, does that mean that somebody who consumes alcohol very regularly will be impacted, or is it just the quantity of alcohol that's going to impact this?
It's both. So people who consume more amount of alcohol will have central effects which lead to snoring. Quantity of alcohol which is consumed also causes effect on the tone of the muscle. Second to which the person who has consumed excessive amount of alcohol will also snore.
Okay, so I'm thinking that it's because the muscles are very relaxed, they just fall back, they're not able to breathe properly, and it's also usually, I think, the way they sleep, the position and the direction in which they sleep, that also impacts this, right?
Exactly.
But when we talk about the way a person sleeps, is it not true that when a person sleeps flat, the chances of him snoring more is there, or how does it work?
It is true. So as you sleep flat, the tongue falling back is more than when you're sleeping to the side. The tongue falling back is lesser because it will be more to the
side.
lateral side. So it will come forward, so the airway is preserved. So sleeping flat is a major risk factor for snoring. So people who are snoring, if they start sleeping to the side, the snoring will reduce.
What are some of the common symptoms that one person can notice other than just noticing that they are snoring, right? Many people may not have some family members around who can identify that a person is snoring. How does one identify, or are there any other symptoms other than just hypertension and something extreme? Are there some basic symptoms that we can look at?
Yeah, definitely there will be a lot of basic symptoms which can be there. The most common thing is excessive sleepiness in the daytime. When someone is watching TV or reading a newspaper or just sitting idle or waiting for the signal in a traffic jam, they tend to doze off.
Okay.
That's the major and most common symptom of snoring.
Okay.
And also in the morning when they get up after more than 6 or 7 hours of sleep, they still don't feel very fresh. The reason behind that is again because of lack of oxygen while sleeping in the night. So that is a major symptom which anyone can assess by themselves.
So when we look at the supply of oxygen itself being a very important thing, right? Does that mean that people in the city where the oxygen levels in the air is a little lesser than villages or in forests would be more impacted by the symptoms and the adverse effects of snoring, or is it more that it really doesn't matter?
It really doesn't matter because the major change in the percentage of oxygen in the air can be some amount percentages. So that really doesn't affect the location of the patient, because snoring as such is not good.
Okay.
So anywhere a patient snores, the oxygen saturation or the oxygen consumption is the same, and also the patient breathing in will be reducing. So the air quantity breathing in will be less. So that in turn will impact.
Actually doesn't make a lot of difference if somebody says that I'm away from the city, I can actually get rid of it. It's not a prevention.
It's not a prevention. It is definitely a prevention if they staying away from city and utilize it for reducing their weight and ensuring that they are fitter. That way definitely it helps. But just by shifting yourself and continuing your same lifestyle doesn't help.
Then it brings me to this question where we talk about what are some of the steps that we can take to really identify it and cure it and also prevent it.
So the first and the best way to go forward is to ensure that you exercise regularly. You stick to a very good diet plan to reduce your weight, and also to exercise more and more to keep your overall fitness level in a good way, and also ensure that you sleep properly. And if at all there's any kind of issue inside the nose or in the throat, get it evaluated. Visit the ENT surgeon or a pulmonologist to ensure that they assess how you are, and then take it forward.
Okay, so there are some of these sleep studies also that happen, right? So is that any different, or how is it different in terms of an ENT examining a patient when he's awake and looking at the patient, or when we do some sleep studies of how the sleeping pattern is? Is there any difference there?
So when I am going to examine a patient, the patient is awake, so the patient won't snore. So we do a sleep study to assess how the patient is sleeping. So how many times the patient has a apnea. If it's more than 35 in an hour, it's very, very dangerous.
Okay.
That means that the patient needs to have some amount of supportive airway while sleeping. So you have those masks, sleeping masks, which push in air through your nose to keep you from breathing.
Okay.
It helps you in breathing, so it prevents apnea.
So when you talk about the sleep masks, is it that something that the public can actually go and pick it up, and is it healthy, or is it okay for a normal person to just pick it up, or is it something we need to consult a doctor before we can actually do that?
So even if you go and buy it directly, you can't. No one would be giving it to you without a set prescription, because if it's pressure regulated,
Okay.
and it depends on how much of an obstruction is there in order to give the titrated pressure values. So if a normal person wears such amount of high pressure, it leads to damage of the lungs. So it's definitely not advisable and not even recommended to directly go and buy a sleeping apparatus.
Okay. The reason I was just asking that, doctor, is because I've heard of some of these oxygen bars in different countries. I'm not aware of it still being in India, but in different countries abroad, where people actually go who can just try breathing oxygen and very high volume or concentration of oxygen, which actually makes them much healthier, their brain development increases, and so many other things, right? So that I know is not really affecting the anatomy of the nose and the breathing, but is that going to in turn somehow affect with overcoming some of these symptoms?
No. Oxygen bars usually are for a regular public to just go consume some extra amount of concentrated oxygen, which is again still not clinically proven that it is going to help in any which ways. Whatever sleeping masks or sleeping aids which we prescribe is totally different than that.
Okay.
In this one, we are just increasing the normal air pressure, whatever you're breathing, the normal room air, in a higher dose. We are not adding extra oxygen to it.
Okay. So I think to summarize, Dr. Prashanth, we can say that snoring is something we should not ignore. It's usually an indication to some deeper problem than something that we can just look at as an oversight and then go about it. And also, there is a lot of options that we can try to prevent the effects, the adverse effects, and the earlier diagnosis is the best. I think with most of the medical issues, it's the same thing. So even with snoring, don't ignore it is what would be the message.
Yes.
All right. Okay. Thank you, Prashanth. And we'll meet in another episode of Mera Doctor. Thank you.
Thank you.